How does frontotemporal dementia cause disinhibition? Imagine a person suddenly acting without thinking, saying things that are inappropriate, or behaving impulsively in ways they never would before. This can be a sign of frontotemporal dementia, especially its behavioral variant. But how does this brain condition lead to such loss of restraint? Frontotemporal dementia causes disinhibition mainly because it damages the frontal lobes of the brain. These areas, especially the prefrontal cortex, are like the brain's control center for behavior. They help us judge what's appropriate, control impulses, and understand social norms. When these regions start to shrink and develop abnormal protein buildup, their ability to regulate behavior diminishes. Specifically, the degeneration affects parts of the prefrontal cortex, such as the dorsolateral prefrontal cortex and the inferior frontal gyrus. These regions are crucial for executive functions like decision-making and response inhibition. When they are damaged, the brain struggles to suppress impulsive actions, leading to behaviors that seem reckless or socially inappropriate. Research shows that in frontotemporal dementia, neural connectivity also changes. The brain's normal rhythms, especially beta-frequency oscillations, become disrupted. These rhythms are important for switching between different mental states and controlling actions. When these oscillations are reduced, the brain cannot effectively manage behavioral transitions, which contributes to disinhibition. Another key factor involves brain networks that support behavioral control. The frontoparietal network and the cingulo-opercular network help us stay focused and inhibit inappropriate responses. Damage to these networks, due to frontal lobe degeneration, weakens their ability to keep impulses in check. As a result, individuals may act impulsively or without regard for social rules. Disconnection among different brain regions also plays a role. When the frontal lobes lose their ability to communicate with other parts like the temporal lobes, basal ganglia, and parietal areas, the overall control system becomes less effective. This widespread disruption impairs social cognition and judgment, making disinhibited behaviors more likely. Furthermore, frontotemporal dementia affects the brain's ability to understand social cues and empathize with others. Normally, empathy and social awareness help us restrain inappropriate actions. When these abilities decline, patients may no longer recognize how their behavior affects others, leading to more impulsive and socially disruptive actions. In practical terms, disinhibition can look like acting without thinking, making inappropriate jokes, or engaging in risky behaviors. It often causes stress for families and caregivers because the person may no longer follow social norms or safety rules. Since this form of dementia often affects people in their 40s or 60s, it can be especially challenging for working adults and their loved ones. Currently, there is no cure for frontotemporal dementia or its disinhibition symptoms. Treatment focuses on supportive care, behavioral strategies, and creating safe environments to help manage these behaviors. In summary, frontotemporal dementia causes disinhibition because it damages the frontal lobes and disrupts the brain networks that control impulses and social behavior. The loss of social cognition and empathy further worsens these behaviors, making it difficult for individuals to regulate their actions. Always consult healthcare professionals for personalized advice and support if you or someone you know is affected by these changes.